First coronavirus case. Many concerned right now with a whole lot of questions, and glad to have Dr. T, Dr. Trpkovski from Doctors of Waikiki. Thank you for coming here. You and Alan Wu, we've talked to both of you guys a couple of times because you're kind of on the leading edge in very many ways. You're regular general doctors for many of us in the general public, but you treat walk-in patients who are on vacation. I mentioned earlier you're among the first to submit what you thought could have been a potential case, and you just shared to me the history of why you submitted it. Talk to me a little bit about these people that walked in and what kind of raised alarm bells in your mind.
Well, about 3+ weeks ago, we had these patients come in from China, and we didn't know exactly we're from China until we did the interview. And then they said, well, we were from Wuhan. And we all kind of got scared. And then they had come in because they were coughing, and they had some lower and upper respiratory tract symptoms. But they were in prior to Wuhan, they were in Hong Kong for 2 weeks, but we still felt that they fell into that window. So we did some precautionary measures. We did the samples, and we sent those to the Department of Health. But later we found out that they declined because they felt that they fell out of the window for possible suspect coronavirus.
Well, the protocols have certainly been widened since then. If that were to happen again,
Yeah,
no doubt
definitely.
they would have jumped right on that, especially here in Wuhan, China. What is the one thing that, if there's a headline or a bullet point or two or three that you want to get out to people, what do you want people to know about the possibility of contracting it and what you should do if you feel like, hey, maybe I'm kind of not right coming down with something?
Well, first off, I don't want the public to panic, because panic only leads to misinformation and other problems. Everyone needs to be more cautious about washing their hands and hygiene, because that's how it's going to be spread mostly, through touching things and touching your face or touching your mouth. If you're sick, go see your doctor. Now, what kind of things we look for? Fever, lower respiratory tract infection symptoms, and especially if you've had contact or suspect contact with somebody that could have had the COVID-19 virus. That gentleman that recently got diagnosed, he was very smart, very nice, that he went and did a self-quarantine, and we're lucky that he did so. But more than likely, he still had some exposure to other people. Hopefully, this will be the limit of the cases, but I doubt. More than likely, we'll have more cases. But what people should know is that people get sick. Not everybody gets very sick. Majority of people have very minor symptoms, and it passes. Only people that have high-risk illnesses tend to get more ill, and of those small percentage of them tend to get very, very sick and can pass away. That's what I want everyone to know. Not everyone's going to die. Not everyone's going to get really, really sick.
Right, and in fact, that we should reiterate this man that's in Hawaii's first positive. He's home.
Yeah, he's at home.
Well.
Yeah, he's not in the hospital. He's at home.
So, all right. Bottom line, if you start to feel, now's the time, because you should be contagious, hopefully for another 3-4 days. Don't wait until you get bleh.
Correct.
You know when you're badly sick. Don't wait that long.
Exactly.
Doc, thank that. Appreciate you. Oh, wait a minute. Wait. Yeah, that's the new protocol. I failed for the foot bump. All right, we'll be right back. We'll sanitize. Justin Cruz will have your weather.